Hi friends, Nina Lynn here, congressional candidate for CA40. Welcome back to Truth Thursday, where every week I answer the hard-hitting questions submitted by you. So today, my first question is from Lisa from Lake Elsinore. And Lisa asks, healthcare costs keep rising. What specific changes will you push to lower premiums and protect Medicare and Medicaid, and how do we pay for it? So here's the truth, Lisa. Yes, healthcare is incredibly expensive because the system isn't transparent and it's not aligned with the needs of the patients. One of the biggest problems is inflation inside the system. Now, hospitals routinely charge insurance companies far more than the real cost of routine items and services. So like basic drugs, lab work, standard procedures, they inflate the prices. And the markup doesn't just stay on paper, they pass it down to you and I, which means higher premiums, higher deductibles, and higher copays. So I do support real hospital price transparency and accountability, not the kind where hospitals dump unreadable spreadsheets online, but actual rules that actually limit excessive markups and tie prices closer to real costs. Because when pricing is honest, it puts downward pressure on the entire system. Now, the other side of this is insurance. Right now, too many insurance dollars go towards administration, denial systems, and late-stage care instead of keeping people healthy in the first place. So I support insurance accountability that shifts more investment up front, meaning preventive care, early intervention, and mental health support, and of course, chronic care management. And because treating problems earlier costs less than waiting until people are sick and in crisis, enough to end up in the ER. Another major reason healthcare costs so much is because we simply don't have enough doctors, nurses, or mental health providers, especially in high-cost and underserved areas. When there are not enough providers, care is delayed, burnout rises, and of course, cost goes up for everyone. And a practical solution for that is to pay for education in exchange for service, modeled after programs like the GI Bill and the ROTC. So if someone commits to working as a doctor, nurse, or a mental health provider in a community that needs them for a set number of years, their education or training should be partially or fully covered. And that will fill shortages, improve access, lower the cost over time, and lets people serve without being buried in debt. Long-term care, let's talk about that. It is the place where we are failing families. It forces us to wait until people are in crisis. I have dealt with it in my own family. It affects seniors, people with disabilities, loved ones with mental health challenges. Then it's even more expensive when you're in crisis to deal with those situations. It's even more expensive not only with what it costs, but the emotional capital that the families go through. Investing earlier in home care and community-based care is not only more humane and life-saving, it's just far more cost-effective. Now, to answer your question, Lisa, about Medicare and Medicaid, let me be very clear. Protecting them is non-negotiable. I will oppose cuts that push costs onto seniors, people with disabilities, or states. But protecting these programs doesn't mean ignoring waste. It means tightening oversight, improving care coordination, reducing administration bloat, and making sure that the money actually goes to the patients, not the middleman. And because our country is running at a deficit, we have to be honest and mindful about how this gets paid for. This is not about new massive spending, it's about smarter spending. We pay for this by, number one, reducing excessive hospital markups, cutting administrative waste, filling workforce shortages that drive overtime and emergency costs, And most importantly, investing earlier in preventative and intervention care so that we don't have to pay more later. Now, that's how you protect Medicare and Medicaid and lower costs, by fixing the incentives, not pretending that the problem doesn't exist. Lisa, it's a complex issue that will require more than this moment in time here, but the solution needs to be comprehensive and realistic. This is not about left or right. This is about a new way forward. Again, this is Nina Lynn, candidate for CA40. Like and follow me for more. Thank you.